Disadvantage overview. Cuban healthcare is improving rapidly, and by easing the embargo will hurt Cuba's healthcare industry. The embargo strains Cuba's healthcare and overall economy. Cuba's healthcare is good and it's improving. Cuba has the highest doctor-patient ratio in the entire world, and it's the only poor country that can say that basic health is not a problem for its people. But once the embargo is lifted, foreign patients will overwhelm facilities. Cuban physicians and nurses will leave their country to seek much better incomes compared to their incomes at home. Without highly trained physicians and nurses, it hurts the healthcare in Cuba. Without good healthcare, it will lead to diseases, and diseases will lead to extinction. The time frame, it will happen very soon after they lift the embargo. The probability, it is very likely that by easing the embargo, it will hurt Cuba's healthcare industry. Magnitude, without healthcare, it will lead to diseases, and diseases will lead to extinction. He said that Cuban healthcare cannot solve diseases and that Cuban's healthcare is struggling, but Cuban healthcare is doing good. Lots of doctors and focus on prevention. According to Campion and Morrissey 2013, there are too many doctors. Everybody has a family physician. Everything is free. It is tightly organized, and the first priority is prevention. He also said that healthcare is declining and it's crumbling, but Cuban's healthcare is strong. Lots of positive trends. According to Campion and Morrissey 2013, this highly structured prevention-oriented system has produced positive results. Vaccination rates in Cuba are among the highest in the world, and Cuba's literacy rate is 99%, and health education is part of the mandatory school curriculum. Topicality overview. Economic engagement is limited to expanding economic types. Economic engagement policies are strategic integration behavior, which involves in the target state. Entirely to deepen the economic relations, to create economic intersection, interconnectedness, and mutual dependence, and finally seeks economic interdependence. But lifting embargo on Cuba does not belong in the category of economic engagement. Exports, imports, and finance belong in the category of economic engagement, but travel, military, diplomatic, and cultural engagements are not in the category because they are not directly involved with economy. Our interpretation is the best middle ground because it still allows the affirmative to choose a number of positive sanctions and objectives, and the topic won't be too broad and the negative can't defend. The voting issue is that non-economic areas are huge, overstretched research burdens, and require completely different strategies. Trade and finance allow sufficient flexibility, but
2 minutes left.
But lock in a core mechanism for preparation. And he said that commerce is functionally equivalent to economics, but it's not. It's not directly involved with economy, and if you want us to talk about commerce also, it will be too broad of a topic, and it will be a great research burden on us. I only have that.
Aki, you have 2 minutes and 30 seconds to prepare.
Oh, that's like a minute.